Hi, everyone. I'm John Freitag with Freitag Family Agency, along with Donna Daychuk from Rothkopf Elder Law and Desiree Krager from Premier Home Care. And our special guest today is actually my wife, Stephanie Freitag
Hi.
from Freitag Family Agency. Steph, do you want to give a little bit of introduction, a little bit of background about yourself?
So I have been working insurance for about 10 years now. I started out primarily with benefit education for a company based out of Plymouth, Maine, where we're educating people on their benefits, particularly around the open enrollment time. But we also worked in large part with people as they were retiring and transitioning over to Medicare or just leaving their company and finding individual healthcare. So really came from that benefit education background, making sure people understood their insurance options and kind of guiding them to what they thought would be the best based on what their needs were. A couple years ago, made the transition to sort of be a stay-at-home mom because of and then COVID. But during that process, really worked towards getting the insurance license and really started getting this whole ball rolling, so to speak. So really, it's that benefit education background that I like to bring to my clients and my appointments, because ultimately you want to do what's going to work best for them.
Right. And I think that ties in great with what we're all doing here is we're all trying to educate people and give them the information they need to make their own decisions.
Yes.
Right. So that's exactly what Desiree and Donna are doing as well.
Yes.
And Rothkopf does a lot of education.
Yes.
So it really ties in.
That's for sure.
So Steph's got a presentation that she's going to share here, a little bit of Medicare 101. And just to remind everyone, we're now recording these videos. So you'll be able to pause them, rewind. If you have questions, we'll share contact information so you're able to reach out and we'll be able to get the answers to you.
Yep.
All right. So let me know if you can see our screen here. All right. Can you see everything?
Yeah, we can see it.
All right. So
basically, a little bit of what we like to call our Medicare 101. We really want to touch on today is about how we as professionals can expand our professional resources, because the more tools you have in your toolkit, the better. You want your clients, your residents, your individuals that you're working with to come to you with their questions. So you can really, even if it's not a service you provide, you can point them in the right direction to a trusted individual. We also are going to talk about how you can proactively prevent billing issues for those of you that work in these communities. When you have people moving in, that's the dreaded phone call. You don't want to get those, calls about those billing issues. How you can save your residents, money. How can you help stretch their resources, stretch their funds? And then also we'll just go back over the basics of Medicare. I don't know how many of you may have been around last time when I did it last fall, but again, it never hurts to refresh and review the pieces.
Right. And we're going to try to keep this presentation more geared towards people working in communities, like the independent livings, the assisted livings, all those types of communities.
Yes. All right. So again, talking about how you can expand your resources. When you have individuals coming into your community, living in your community, you are a trusted source for them. You're a trusted person that they can come to when they have need advice on things like who their doctors are. You're already providing them with these preferred partners that you're working with. You're suggesting or recommending a primary doctor to them, therapy providers, pharmacy providers. You already have all those tools that you're offering to them, and they're trusting that these are all trusted partners that you work with. So why not expand that a little bit more? Why not have a professional that you can recommend to them that would also be able to review and look at their insurance benefits for them to make sure that they are in a plan that's really the right fit, that's going to work with your preferred providers.
Right. And I can tell you firsthand, I was a admissions person at a SNF for a couple of years, right? Mm-hmm. And people come to you like you're the first face they see when they're moving in. You're helping them with all the move-in paperwork. You're telling them who the physician's going to be. You're telling them all the stuff that you're setting up. So they do look to you for some recommendations. And even if it's an issue that's not related to the admissions role, they're always coming to you anyway. Whether it's a nursing concern or it's a therapy concern, they're always coming to the admissions person because that's the person that they met first and that's the person they trust. So we
And also, John, I did that role for a while myself, and you have people that come in from out of state, even just from out of the area. They might, like, you might be in Bucks County, but all of their doctors and physicians and everything might be in another county. So again, it would be really great to be able to be that resource. And it might make sense at this particular time to educate them on their choices. Good point.
Yeah. And we talk about it actually in paths, like we're in paths together, Professional Alliance, to help seniors. And we use that like to our advantage to be able to help people network like together, because we're like, okay, so we might not have all the answers for you, but we could know an elder care lawyer who can handle this, or we know a realtor who can handle this. And it keeps people coming back to you. You're the expert, you're the person that they want to always talk to.
Right.
And you want that. You want them to always come back to you and have that relationship there. So we just want to be another tool in your tool belt.
Right.
Right.
So, talking about expanding the resources and having an insurance broker in that arsenal, one of the things we mentioned about what we want to talk about is proactively preventing billing issues. Nobody wants to get that phone call from the family member or have the resident coming down to your door knocking about a bill that they got in the mail that they weren't expecting to get. So when someone's moving into a community, most people, like you mentioned, are moving maybe from the next county over or coming from out of state, whatever the case may be. Even if it's just a couple towns over, their doctor might change, their community hospital might change, their pharmacy is probably going to change. So all of those things are things that people, particularly their primary doctor and the pharmacy, that they use regularly, and they're going to be, having experiences with them. So if they are changing their pharmacy, changing their doctor without proactively looking to see if that's going to still work with their current health insurance plan, they're going to be getting those surprises in the mail, unfortunately. So we want to have them, sit down and just make sure, am I still in a good place? Is the plan I'm on still the best fit for me? Because they do get that window, 60 days from their move-in date, to make changes if they're on a Medicare Advantage plan, particularly if they're in a Medicare Advantage plan. But even if they have a supplement, not touching really the supplement, because that's not network related at all, but their drug plan at least. Look and make sure that your pharmacy that you want to use with your community is going to work with your drug plan. Are they on new medications because of whatever precipitated the move into the community? Are those covered under their drug plan? Are they getting the best prices that they can? So those are all pieces we really want to look at to prevent them having any surprise bills or unexpected charges.
Yeah, and we say being proactive, look at it proactively, because lots of times people don't realize that they actually have an issue until it's a little bit further down the line, and they might miss that window. Like Steph mentioned, there's a 60-day window when someone moves in. They might not realize that it's going to be a billing issue until 62 days later, and then by then it's too late and they have to wait until the next annual enrollment period, or if they were to have some other sort of special enrollment period.
Right. And this is also an opportunity to find out if they do have any gaps, if they're missing anything. You'd be surprised at the number of people that don't have a drug plan, that lost their B, don't have either a supplement or an Advantage plan, and just have original Medicare. So these are opportunities to rectify that and, start eliminating some of those higher medical expenses that you get when you don't have that coverage.
Right.
So again, how do you, help save your residents money? Well, as we discussed with the moving, by using preferred providers that are in network, a preferred pharmacy that you're going to get the preferred rates at, we can make sure that they aren't spending, we're decreasing what they're spending on their care and their services. So we can make sure when we sit down with them that, yes, the doctors are going to be in network if you want to use the community providers. Yes, the pharmacies and network, it's a preferred pharmacy. Yes, your meds are going to be covered. So you're really just doing that due diligence at that point, making sure that they're going to have the lowest possible out of pocket for their medical expenses. And by doing that, you're often substantially, looking at saving them
decent
amount of money, which can extend their ability to stay in a facility for longer, can potentially, help them pay for a higher level of care, get more support.
Or even hire like home care providers to bring them into the facility because they're saving a little bit extra money.
Right.
So, I mean, these are all just different things. Everyone could stand to save a little bit of money, even if you're very well off and you have a lot of finances.
Right.
It's worth looking and seeing if you can save something and use that towards your care somewhere else. Right.
Right. I think it's just a valuable opportunity because we have both run into our share of people that have had the same plan for 10, 15 years. It's not the best plan on the market anymore. It doesn't, have all the extra benefits or extra perks that they could be getting, with, especially in the Advantage world. They have all these, better perks in terms of over the counter,
And people get complacent because they have something that they like.
It works.
It's been working for them. It hasn't been causing any pain.
So
why touch it?
Right.
But that's not really the best mindset to be in. Even if it's not causing you any issues, you still want to just do a double check and look at it, because
especially when you're in the Advantage plan world. With the supplements, I mean, nothing really changes there, so they don't have to review. But when you're in that Advantage plan world, and even with your drug plans, that's something you should be looking at annually, because your costs could be going up and there could be something better out there for you.
Right. All right.
I mean, it just comes back to why use an insurance broker. So first and foremost, of course, there's no cost to the individual for using our services. We don't charge for our services. We get paid by the insurance company. So really just sit down with us, have a conversation. There's no fee, there's no obligation. Medicare is confusing. I mean, it took me, years to get a good understanding on it, and I'm still learning too. I mean, things are always changing. We get certified, take trainings every year so that we can better educate our clients. The plans and networks change each year. So again, coming back to the drug plans, the Medicare Advantage plans, there's going to be changes annually to those plans. So to sit down and review it, you're really just doing someone a good, service, making sure that they're getting.
How long does it take to do a review?
I mean, a basic review, just to check someone's doctors, check someone's medications, 15, 20 minutes to plug everything in if it's not, overly complicated. I mean, it's not something that has to be all time consuming, and it just gives people the opportunity to ask questions. And then we work for the individual, not for the insurance company. We're independent, so we are contracted with most of the major insurance carriers in the area. So we're not beholden to any one company. We're not going to push anyone in one particular direction. It's really presenting the options of what's going to work best based on their needs.
Yep. So our goal is to just educate the client, educate the community, lay out the options, and help them make an informed decision. So at the end of the day, it's the client's decision on which way they want to go. So now we'll go over some Medicare basics.
So just the basics of Medicare. You really start out with original Medicare, which is your lovely red, white, and blue card, the A and the B. Then you get your Medicare supplements as another piece of the puzzle, a Medigap sometimes referred to. We have the Medicare drug plans, which is your prescription drug coverage or your Part D. And then you'll have also the Medicare Advantage plans, sometimes called Medicare replacement plans or Part C. So Medicare Part A, just a general background, it covers your inpatient care in a hospital, skilled nursing facility care, nursing home care, inpatient care in a skilled nursing facility that's not custodial or long-term care, hospice care, and home health care. Then you're eligible for Part A when you turn 65 or older. If you're disabled, so you can get it potentially earlier than age 65, and end-stage renal disease and ALS are going to also be qualifiers for Part A. Medicare Part B is going to cover things like your clinical research, your ambulance services, durable medical equipment, mental health, partial hospitalization, and limited outpatient prescription drugs. I always tell people this is like your doctor's services. Pretty much if it's done on an outpatient level, this is your Part B. That's what that's going to cover. So in terms of eligibility for Part B, individuals who must pay a premium for Part A must meet the following requirements to enroll in Part B. You must be age 65 or older again, or and I should say, be a U.S. resident and be either a U.S. citizen or be an alien who's been lawfully admitted for permanent residence and has been residing in the United States for 5 continuous years prior to the month of filing an application for Medicare. So you basically have to be some type of lawful residence of the country. Part B is also something that they consider to be voluntary because it does require a payment of a monthly premium for your coverage.
And we're surprised to see this year, actually, Part B are going down.
To go down for next year. They had that big jump for this year, but we're actually seeing a little bit of relief. They're going down slightly for next year. So that's
a few bucks.
It's always good to see. Every little bit helps, you know. So the question, you know, you have Medicare A and B. Why is that not enough? Why do I need something else? Well, because you're going to have holes or gaps in your coverage when you just have A and B. So the Medicare supplements, or the Medigap, is helped to fill those gaps of original Medicare. It's sold by private insurance companies. Original Medicare typically is only going to pay so much. So I would say, to make it simple, usually 80%, and then you have a 20% co-insurance. With original Medicare, there's no limit out of pocket to what you can pay annually. So those bills could just keep rolling in a catastrophic situation. So your co-payments, your co-insurance, those things aren't going to stop. So one thing that's with the supplement is that's going to start taking care of what's not being covered by original Medicare. So your co-payments, your co-insurance, that 20% is the biggie, and the deductibles can be, for the most part, covered by a Medigap plan.
Right. And Medigap plans are only going to cover what traditional Medicare covers. So if it's something Medicare doesn't cover, your Medigap plan won't cover it either.
Right.
Might say that in here.
Might say that in here, yes. So it does say, you know, you must have Medicare A and B in order for that coordination of benefits to work. A Medigap policy is different from a Medicare Advantage plan. Those plans are ways to get Medicare benefits, while a Medigap policy only supplements your original Medicare benefits. You're going to pay a private insurance company a monthly premium in addition to what you're paying for Medicare Part B for your Medigap policy. You can buy a Medigap policy from any insurance company that's licensed in your state to sell one. And there's a wealth.
There's tons. There's a lot of companies.
There's so many. Any standardized Medigap policy is guaranteed renewable, even if you have health problems. So once you're in the policy, they can't kick you out. So that's a plus there. Medigap policies generally don't cover long-term care, vision or dental care, hearing aids, eyeglasses, or private duty nursing, because that's, again, coming back to, it's really only going to cover what original Medicare covers. And since they don't cover those things currently, neither will a Medigap policy.
Does Medicare cover hearing aids now? Isn't that a change?
That's not taking effect right away. It's like some sort of tiered program that they do, and they're going to allow hearing aids to be able to be purchased over the counter. Was one of the big things.
Yeah. Yep. So when you go the route of getting a Medicare supplement, Medigap policy, you're also going to want to get a Medicare Part D prescription drug plan, because neither of those pieces are going to cover most prescription drugs. There are some Part B drugs, but majority of your medications are going to go through a prescription drug plan or a Part D. So this is going to help you pay for those prescription drugs. Even if you don't take prescription drugs, you should get a Part D to avoid a penalty. There's 2 ways you can get your drug coverage. If you're going the route of original Medicare with a supplement, then you're going to get what's called a standalone Medicare drug plan. Those plans will cover, you know, drugs. Again, you'll have your original Medicare, your A, your B, potentially your supplement, and then you'll have your standalone D plan to cover your medication costs, your drugs. The alternative to a standalone drug plan is a Medicare Advantage plan or Part C that includes a prescription drug piece rolled into it. Medicare Advantage plans. So Medicare Advantage plans, we see more and more of these on the market these days, and especially this time of year, get fired up for those commercials to be on the air.
I can say some people, even with a Medicare Advantage plan, think they might be on a sup. I've had a lot of people that I've talked to, and they say my supplement
That's true.
But if you dig a little bit and you find out, say, are you paying every month for it? And if they say, no, I'm not paying for it, chances are they probably don't have a supplement. They're probably in an Advantage plan and just don't realize it and are using the wrong terminology.
Yeah, you get a lot of that. I mean, the easiest way to circumvent that is to ask to see their cards, because the terms do, I find, get interchanged a lot. People do confuse them. So Medicare Advantage plans, not to be confused by Medicare supplements, are actually what we call sometimes replacement plans. So you're no longer going through original Medicare. Now your benefits and care are being managed by an insurance company. So you have your HMO plans. So with just the HMO, typically means, your plan pays for most of your services, but out of network, you're typically not going to have any coverage except for emergencies. There are some hybrids like the HMO point of service where you may have some services out of network, but higher costs. Then you have your PPO plan options where you have both an in and out of network level of benefits, but again, out of network is going to be more. And then we do have some special needs plans that are going to be geared specifically towards people that have either dual eligibility through Medicare and Medicaid, institutionalized, or chronic conditions.
Right. So
that brings up a good point, right? So if you are an admissions director and you're moving people into a community and they do have the Medicare Advantage plans, they absolutely need you guys. So they need to have an insurance broker, because we got to make sure that they are in network, that the physician that comes into the community is in network and all of that stuff. Am I correct in assuming that?
Yeah, I mean, that's one of the things we really want to highlight is that if you see someone coming into your community and they have a Medicare Advantage plan and they aren't working with a broker that's, reviewing their coverage with them annually, they need to talk to somebody, because things are going to be changing, if they haven't already. So they definitely want to talk to somebody and just review it, make sure they're still on the best possible coverage that they can be on, and that it's going to work with the providers they're going to be seeing now.
Yeah, because you look at some of the HMO plans, some have very narrow networks, and they might have picked their plan when they lived in the community based on different benefits and made sure that their PCP, their doctor, was in network. Now they moved, their doctor changed, the network's no longer covering that doctor.
Right.
They might not realize it right away until they get some big bill for seeing an out of network doc, or it's just rejected.
Right.
So it's really important. That's a good question, Donna.
Right. And you just want to, like I said, look at it and make sure they're getting all the possible,
Yeah, and we're talking more for people moving into independent living, assisted living, memory cares, not so much the SNFs right here in this conversation.
Yes.
So again, with the Medicare Advantage plans, they also can offer extra benefits for individuals. Fitness memberships, fitness programs are one of the big ones. Solar sneakers.
I went to one class.
Sean went to a class. Vision, hearing, and dental services. So again, things that you aren't traditionally getting from your original Medicare can be covered and typically have some benefits through these Medicare Advantage plans. So if someone's in need of glasses, hearing aids, those are services that we might focus on plans that have better benefits for them if that's a need right now. Many plans also offer coverage for services like transportation to and from doctor's visits, over-the-counter drugs. A lot of the plans will have cards that, will help give you a quarterly allowance to pay for over-the-counter items not covered by the drug plans.
Now they're even doing healthy food cards.
Yep. Some of the plans have hybrid ones that are healthy food. Some that literally have, it's like a flex card and they can pretty much use it on anything. It's, it just depends on what the individual's need is.
So at the end of the day, everyone's needs are different. So what I like to tell people, especially when I see them at a convention or a educational thing, it's like the person sitting next to you, their needs aren't going to be exactly the same as the other person across the room, and everyone's finances aren't the same either. So it's worthwhile to sit down and talk to someone about your individual needs. If there was one plan that was the best for everyone, that's all there would be out there. There are a variety of plans out there that are geared towards all different situations. So it's worthwhile to just sit down, take a few minutes, to talk about what your needs are.
Right.
And we do a needs assessment. We see what your needs are, what your what path you'd like to go, whether it's a Advantage plan or a supplement plan.
Right.
Sometimes you're locked into one or the other because of what you chose earlier when you initially enrolled. But if you're just looking at it for the first time, we can help you make the right decision with that too, for whatever your personal situation is. Here, I'm going to turn off this screen sharing here.
You know, we were talking earlier, John, about like what we think is a good plan. Until you review it and look at what they're paying and what their needs are, it might seem like it's a lot of money to us, but in relative to what their needs are, it might be a bargain for them. So you can't just assume that
Right.
one shoe will fit everyone, because
Right.
there's just so
Yeah.
many
Right.
different situations.
Yeah,
Yeah.
there's what the old adage, don't count someone else's money, right? Or is that how
Yeah.
it goes? Right. So you don't want to make any decisions for them.
Right.
What our job is to do is to give them the options, right? And educate
Right.
them on each one so they can see which one's
Right.
going to work best for them.
I was
Like we
just
were
gonna,
talking,
sorry about
no,
that.
no, I was saying before we jumped on here, we were talking about some of the I'll say, oh crap rates, right? That one of our colleagues calls it. So some of these rates for some supplements could be over $500, which you might gasp at, but for some people that'd be totally affordable and their best option.
Right.
Where other people, they couldn't afford it, so it's
Right.
not really an option, but at least
Right.
they can see what's out there
Right.
and let them make the decision.
And because the thing is, one of the things is when people are moving into a community, if they are on an Advantage plan, and now the question comes up of, I really think I should be on a supplement, I don't want to have to deal with the
Mhm.
networks or the approvals, I need more care. I want to have a supplement so it can pay my bills. The question that we run into there is then, can they still get into the supplement? Because unlike the Advantage plan where you have that window to change your plan because of the move, you don't get an open enrollment with your supplements beyond when you initially enroll in Medicare Part B. So once that window passes, there's really very few opportunities for people to go into a supplement without having any health questions asked. So could the person moving into an independent living potentially still switch to a supplement?
Maybe.
Possibly. But it's going to come down to, questions about their health. And again, coming back to the oh crap rate, depending on what their situation is, if there are any certain health conditions, they may still be able to get a policy issued to them, but it might be at a higher premium. But we don't want to,
Right. We don't want to
make
discount
that
it. Well,
decision. If they have planned for that in their, retirement, in their, resources that they have to pay for their care as they get older, then that may still be a possibility. It's just something we want to lay out to them and say, yes, you could potentially still go that route, but here's what that's going to cost you versus, if you go this route, you'll not pay as much upfront, but you are going to pay. I mean, there's no happy answer, I think, in the world
now,
of
pay later.
insurance, pay
Yeah.
now, pay later, but we want to present those options for them and see, what's your pain point,
help them make an educated decision.
where can you go,
Right.
Yeah,
Des,
I
what
was
was
gonna say, I wanted to say how important it is to do this sort of education, because I remember earlier when you were speaking, Steph, you're like, there's so much lingo out there where, someone might have an Advantage or Medicare replacement plan, but they're all saying, I have Medicare. I have, I have Medicare. So there's, a lot of different terminology being thrown and used out there that oftentimes people don't really know what they have. They don't know what's covered. They don't know what their insurance can or cannot do for them. So the more education like this, the better. And then it really, suits you guys with John's social work background and the ability to really, connect with people on multiple levels, whether it's, medically, clinically, socially, you're trying to understand, their needs, and then having the view of their, of coming from a skilled nursing, like you said, facility background is important, because I think a lot of the older population and some younger people, even me, you really don't know, what your insurance covers and doesn't cover. It's like the same thing in like home care in my field. home care and home health are actually two, totally different avenues of care, whether, what type of care and what's covered and what's not. So it's always through that explanation and educating people that it's really important that they understand better.
Oh,
Yeah.
absolutely. And people don't even know. I mean, I've been in the field for a long time, so people don't understand even still that they right away think they have Medicare.
Yeah.
They don't realize, no, you don't have that anymore. You now have, you don't, it's not a supplement. And they think everything is covered at 100%. Even when they go into a nursing home, they
I have
don't
100 days.
understand the
I have 100 days,
copays.
right?
I have 100 days. I
that?
have 100
Yeah.
days. That's what they always say. And they don't, it's like, no, you have to have a skilled need. And then it's only covered for 20 days, but that 20 days are still out of pocket. So,
And it's difficult because everyone's so siloed, right? Like coming from when I worked in the SNF world, right? Everything was all about the skilled nursing facility. Then when I moved in hospice, you're all thinking hospice. So as a broker, it's our job to try to look at the big picture, because we're talking to people sometimes when they're 64 years old, they're trying to figure out what their plan is at 65. And we have to try to think of ahead 20 years. What are they going to need when they're 85 too?
Right.
And help bring it all together. So that's the tough part. And that's why it's like Desiree mentioned, it's nice having the background as coming from the provider side too, because you can draw on all those experiences.
Yeah, it's
Definitely. And that was a good point what you made earlier. It's like that pay now or pay later, or how, it's projecting you might be healthy right now, turning into 65, not on any, major pharmaceutical like drugs, or thinking of like, you're pretty much healthy. So, this plan might work now, but then, you have to weigh the pros and cons of not going into the supplement through the underwriting at that given point in time. Many people, I often don't think we're ever really sat down and educated on that. So it's great that you both, really take the time to educate your clients, which is so huge in all of this. The more education that we're doing, for everyone to know, for me to learn something, for Donna to learn something new, everyone, you don't know what to ask when you just don't know. So.
Right. Yeah. And I think that's a huge part of why we're doing all this, like, ourselves, right? We're putting all these videos together every month because there are so many different resources out there and we don't know it all. Right. And we're trying to educate ourselves and we want to share the information with everyone. So, I mean, if anyone's watching and you think of any good topics that you want to see for future meetings, we're all ears, because there's so much out there that we couldn't even, we couldn't cover every topic if we tried. So fill us in. Right?
Yeah, really.
That's a good great point. Yeah.
Contact us and give us your ideas. What do you want to see? What do you want? I mean, now that we don't have to get up at 8 o'clock in the morning and do these, that we tape them, makes our life a little bit easier. But we want to be able to bring the resources to what is needed, what stands out, what is it that you want to be educated on, or if you want to educate, our audience to something that you have that you feel that could be a resource. We would love to have that as well.
Right. And a little plug, you have we're going to be doing a similar seminar coming up.
Yeah, similar, topic. We are on the 11th next week at 11 a.m. for professionals again to, kind of go back over some of this, maybe dig a little bit deeper into some of it, but not get too deep. But
we'll keep it exciting.
Keep it exciting, at least as exciting as Medicare can be. But and then again in November, we're actually going to be doing a presentation, a Zoom for our community members. So essentially, families. So
residents.
If you have, family email list, or, we can forward out the information, because we'd like to try and just reach as many people as possible. And that's going to more just be a highlight of why they should have somebody looking at the coverage during this time of year, particularly again for those individuals who are on Medicare Advantage plans or have the drug plans. Don't miss your window to make those changes. Don't go through another year of those, bills that are unexpected. So if, we can be of service to educate them on why they, should be looking at their coverage and reviewing their coverage from an unbiased perspective, that's something we just want to bring.
Right. Make it as painless as possible.
Yeah.
Cool. All right. So anything else? We have, do we share your contact info?
Yeah.
So Stephanie at freitagfamilyagency.com or John at freitagfamilyagency.com.
Mhm.
Or you can follow us on Facebook at Freitag Family Agency.
Yep.
All right. Well,
Excellent, excellent
Thanks,
topic.
guys. Always a
Thank you.
pleasure.
Yep.
all right, hold on here.
Mhm.
Where? Hold on. I don't know if maybe I stopped recording.
Still says
Still
recording.
says recording. Oh,